Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. In this video, I would like to talk about 3 reasons why any patient or family member is fully justified in screaming at their doctor or healthcare facility. Now, obviously, I say this somewhat tongue-in-cheek. I'm not suggesting that you go up and shout at your doctor or be verbally or physically aggressive. Of course, that's unacceptable. But what I am saying is that there are often situations, frequently situations in healthcare, where frustration and venting that frustration is very reasonable indeed. In fact, I often walk into this in my job as a hospital doctor. I will walk into a situation, a patient or family member that I've never seen before, and they will basically be screaming at me about a horrible situation. And of course, Dr. Dhand smooths things over and fixes the problem, but I will often just be listening to them because the best thing you can do in that professional situation when someone is venting is just let them vent and listen to what they have to say. But I will be thinking in the back of my head that, whoa, what you're frustrated about is fully justified. In fact, if that was me or a loved one, I would be even more angry. So we do deal with lots of situations in healthcare where we drop the ball, and of course people will be upset, and dropping the ball in healthcare is something that should never happen. We are dealing with people's lives. And I could talk about many different situations, both as an outpatient primary care or as an inpatient in the hospital, which are absolutely unacceptable when they happen. But I want to focus on these 3 that I see all the time, and I've seen all the time for many years, and these problems occur up and down the country every single day. Here we go. Number 1, giving the wrong medications. This is something we call medication reconciliation. And we get this wrong for a number of reasons. So basically what happens is a patient is admitted to the hospital and they won't remember their full medication list or their dosages, or we will have a list on the computer that will be completely outdated. And a family member will come in the next day and realize that their loved one is getting the wrong medications, or we've missed certain medications out. And of course, this is unacceptable in healthcare. And it's not an easy problem to fix, but it's something that we need to be very, very careful about when a patient is admitted to hospital, knowing their exact home medication list and either continuing the medications if appropriate, making adjustments, or stopping them if needed. But we should know exactly what they are taking. It can, for very obvious reasons, be very dangerous indeed if we haven't got medication reconciliation right. So if that's happened to you or a loved one, you have every reason to vent your frustration, because the healthcare facility and the doctors need to know that they have to get this right. And the more you can keep emphasizing this, hopefully the message will get through. And with time, in healthcare, we will get better and better at this. Number 2, not having a clear plan on what's going on. This unfortunately also happens all the time. And I actually have a term for this. Dr. Dhand's term is too many cooks in the healthcare kitchen. And let me paint a scenario for you. A patient, usually an elderly patient, will be admitted to the hospital. They will be seen by a number of different specialists, and they will be getting all these mixed messages. This is a diagnosis, that is a diagnosis. You're going to have this scan, you're going to have that scan done. We are going to do this procedure. Oh no, we're not going to do this procedure. And obviously this is completely unacceptable. The patient and the family are left in limbo. What is going on? Usually there will be one doctor, typically in the United States, an internal medicine physician like myself, who will be the captain of the ship, and they will be in charge of the hospitalization. And they should be the go-to doctor, and they should clarify every single day, ideally, what the plan is, what's going on, what the diagnosis is, what the treatment is, and what the prognosis is. We cannot have any confusion when someone is sick, ill, at a low point in their lives, in the hospital. They have to obviously know what the plan is. They can't be getting all these different messages. So if you as a patient or a family member think that the plan isn't clear every day, or you have no idea what's going on, you're getting all these mixed messages, insist on speaking to the doctor in charge. Number 3, not moving enough. Dr. Dhand has another term for this. I should patent all these terms actually. I call this sinking in bed syndrome. And this is tragic when this happens. It happens every single day in hospitals. A patient who is reasonably functional, often older, but it could happen at any age, especially if they have a serious illness, will be admitted to the hospital, and they will just be lying in bed every single day. The staff will not get them up. They will be getting weaker and weaker. Their muscles will be getting more deconditioned, and then they will have a longer recovery time and be more prone to complications. And a frequent scenario that I see is that a loved one will come into the hospital and they'll almost be begging us to get their relative out of bed and moving. And they shouldn't need to do this. It's horrible when we hear relatives request this and vent their frustration on their relative getting sicker and sicker in the hospital. And this doesn't happen for a number of different reasons, including nursing staff being stretched, hospitals not investing enough in physical therapy staff. But this strikes a nerve for me. As a doctor who specializes in metabolic health and lifestyle medicine, I'm also a certified personal trainer. Now, I wouldn't put them through any intense personal training sessions, but at least get up out of bed if appropriate. And when I see this happening, I will usually write in capital letters as an order, patient must get out of bed to chair 3 times a day and ambulate with assistance if necessary. No excuses. They cannot be lying in bed, sinking in bed, getting weaker and weaker as a result of their hospitalization. So my advice to you, if you're a patient or a family member, usually a family member in this circumstance, and you see your loved one getting sinking in bed syndrome, please vent your full frustration and insist that their hospitalization doesn't make them weaker and less functional, and also more prone to other complications, including a prolonged recovery time or more severe medical complications from just lying in bed and getting deconditioned. So there you go then, 3 situations where any patient or family member would be fully justified in venting their frustration. And again, I'm not suggesting screaming, shouting, being uncivilized, but these things can always be done in the right way. And you have every right to be upset and tell your healthcare facility and ideally the doctor in charge, who is the captain of the ship, like the pilot of a plane. Ultimately, the doctor is the one in charge of the hospitalization, and they should be made aware when we fall short in healthcare, because otherwise things simply won't get better. It is your right as a patient to expect that you have a certain level of care in the hospital at a very low time in your life. Thanks everyone for listening. Let me know your thoughts down below. Hope you found that helpful. Check out my online academy. That link is down below. Hit the like button if you like this video and the bell button for more similar videos in the future. Remember, huge swathes of healthcare and medicine have unfortunately become very corrupted indeed. And one of the best things you can do for your health and your family's health is to make the right decisions every single day. Eat the right food, get the right amount of activity, exercise, take care of any stress in your life, sleep enough so that you have the best possible chance of not even needing doctors, hospitals, and staying away from the medical industrial complex. Hit the like button if you like this video and the bell button for more similar videos in the future. We will talk again very soon.